think we've normalised a lot of beauty treatments now, like you'd go for a haircut, you go for Botox, fillers, microneedling, dermabrasion, etc. And this is where it's become very normal, and I think we've taken the safety risks a bit for granted in terms of that normalisation of treatment, and hence why we're really encouraging you to ask who's giving me the treatment, what treatment and how.
Cosmetic treatments used to be for the rich and famous, but today a quick scroll on social media shows how mainstream they've become. With filters specifically designed to make your lips bigger and your skin smoother, it's no wonder some might turn to treatments to look like that all the time. But these treatments have side effects and need to be taken seriously.
It's something that I've always liked the thought of, that it produces really good results, but I think just starting it, I think you're always going to be having to continue that for a long period of time and do it regularly.
Isn't it better to have beautiful lips, right? And then if you want to widen it up, okay, you buy a pencil and you put it outside.
Yeah.
But when you see the person on one side,
if it's available to people now, then I guess if you have the money, then most people do it. But yeah, maybe social media is not helpful.
There are far too many cowboys and cowgirls who are doing more harm than is really worth.
Vitamin infusions, fillers, there's always something new. Botox is popular, but the drug, used cosmetically to remove wrinkles, requires a prescription.
So it needs to have a doctor prescribe that, or a dentist. If a beautician is giving you that Botox, you are within your rights to ask them who has issued the prescription to that beautician to enable them to give you that product.
These procedures are not widely regulated on the ROC or in the UK. In the UK, it's illegal to administer injectable fillers or Botox to under 18s. However, Dr. Carter confirmed there is no such rule at present on the ROC. Health professionals should be registered with the Medical Registration Board. But in current legislation, there's no provision for regulation of others, such as beauticians, who would need to have a business license to carry out invasive treatments. The decision to grant one is taken by the OFT with guidance from GMRB. The OFT is aware of some places that have been operating without one.
It's been regulated by the OFT as a default licensing authority, and anything which is not covered by the Gibraltar Medical Registration Board, the Gibraltar Nursing Registration Board, would by default be covered by the OFT. So there is always an element of cover there. But I can tell you that the government is proactively looking at specific and bespoke regulation for this type of invasive treatment, particularly because it's a growing area. These type of services were not offered 3 or 4 years ago. There's been a boom, particularly post-COVID-19, and I think it's an area, or government thinks it's an area that needs to be looked at into more detail.
Until there are clear guidelines, these matters are looked at on a case-by-case basis. Public Health Gibraltar and the OFT are asking you to check that any establishment you visit has the correct licence. Dr. Carter says you need to be confident in their safety and hygiene practices.
We use the proper gloves. We also work with a special product for clean the rooms, to disinfect everything. We also work with a local company in order to dispose all the sharps that we produce in every treatment. Every time that we finish a treatment, we drop the needles and everything inside the yellow box, and that box cannot be opened and cannot be used again, the same product that we dispose it there. Every week, few patients come in to fix a treatment that have been done in other places. In other country, for example, in Spain, this kind of treatment can only be performed by doctors, but doctors with a master in aesthetic medicine. And if you are even a doctor, but you don't have that master, you cannot do it.
In the UK, the industry is being described as the Wild West. Dr. Carter says it's an issue many jurisdictions are grappling with as they want to regulate it without curbing freedoms. Until then, you're strongly advised to do your homework.